When I was born, we didn't really know what the long-term outcomes were. We didn't know if I could survive or even live a life with quality. My first central line infection was as a 2-month-old baby. When I was growing up, unfortunately, infections became part of our norm. I had them at least once a year. So I wasn't afraid of the dark or monsters under the bed. I was afraid of a central line infection. Having the fever, the low energy, the uncontrollable shakes, that's the scariest part. And then immediately rushing to the hospital. It's very ingrained in my head. I'm almost chills right now thinking about it. But fortunately, it's been 11 years since my last central line infection. Knock on all wood. Having a complex chronic disease like short bowel syndrome and living with a central line, in my journey, I've had 65 surgeries, 31 central lines, and 25 central line associated bloodstream infections. And I've received care across the US in multiple types of venues. Anytime another person that's not myself touches the line or is required to do any care with the line, my ears go up, eyes are open. I want to make sure that our standard of care is being kept because my central line is my lifeline. I've had care providers not washing their hands in front of me or washing their hands outside of the room, then touching the door, touching the IV pool, touching the pump, then touching the bed, then touching my central line. There's so many sources for contamination. And it's so important for not only the patient, but the medical care provider to be mindful, to understand where they are, who they are treating, and the importance of the central line, the lifeline to the patient. At the time, I was only using non-transparent dressing, which you cannot see your insertion site and requires more frequent dressing changes. I learned about the Curos caps and the CHG Tegaderm dressing. And so I was amazed. Immediately, that means my care will be more convenient. I liked that there was a dressing with antimicrobial agents in it. So I just felt like this is an easy answer to maximize my care. I came back to my home healthcare company and I asked for both of these products immediately. The Curos caps were not on their inventory, but shortly after, it didn't take very long, just a few months, I started getting Curos caps in my delivery. And it's now standard of care, and I'm happy to see that. There's still advocacy we can do to encourage more access to Curos caps. I just was at an outpatient center and they said immediately when they were accessing my line, "Oh, we don't have those green caps, is that okay?" So that's fine, I carry my own. Because I know it comes back to doing your due diligence and speaking up and compensating or advocating by bringing the supplies you need to keep your care at the highest standard, whatever that means. Because at the end of the day, it's me looking at myself in the mirror, and I'm going to be the one living with an IV line infection if I get one. For physicians and medical care providers, I want them to know that it's also important to know the purpose behind their actions for infection control. The reason why we flush the line, wash our hands, knowing that purpose rather than just doing it because their instructor told them gives so much more value and really changes the way they deliver healthcare.